panel discussion titled Regulation, Compliance and the Law, Navigating Policy, Regulation, Data Governance, and Legal Consideration in Healthcare Innovation. As healthcare innovation continues to evolve, building great technology is only one part of the journey. Trust, compliance, data protection, legal frameworks, and responsible implementation are equally critical. Leading this important conversation, we have with us a moderator. Please put your hands together and join me in welcoming Jhanvi Shah, Head of Content and Communication, All Health into Tech. Very, very warm welcome to you, Jhanvi. Joining her on the panel, we have with us Sneha Bhonsle, founder of Benevolent Legal, a healthcare and life sciences lawyer specializing in medical law, healthcare regulation, digital health, data protection, and medico-legal matters. So the next panelist, we have Kanjan Kotecha, Vice President of Products at Certinal, who works at the intersection of AI compliance, data privacy, consent, and healthcare technology. So joining them, we would also like to welcome our next panelist, Dr. Ajit Adipodi, co-founder of Adapt AI Health Tech, whose focuses on helping healthcare organizations move from AI curiosity to real-world AI adoption through clinical workflow integration and implementation frameworks. Together, we're going to have an insightful, diverse perspectives on the legal, regulatory, technological, and clinical dimension of healthcare innovation. Ladies and gentlemen, this promises to be an important conversation. And over to Jhanvi.
Good evening, everybody. Good evening to the panelists here. So I am Jhanvi from All Health Tech. The whole day today, we have been hearing about AI getting into healthcare. But when AI actually enters healthcare, it has a lot of touch points. It comes to patient data, clinical decisions, and even, panel, we are here to discuss not just, how to build AI, how to build trustworthy, compliant, and ready to use in real world AI. So that's something we'll explore. We have a very diverse panel with legal, founder, and a tech perspective here. So to get a head start, I would like to start with innovation versus regulation. So my first question is for you, Sneha. Healthcare AI is evolving faster than legislation. Do you believe India's current legal framework is flexible enough to support innovation, or are startups operating in a regulatory gray zone?
Good evening, everyone, and thank you, Jhanvi, for that question. And I sincerely extend my gratitude to All Health Tech, Karthik, Jhanvi, for arranging this. I'm especially grateful for you to for creating space for legal interaction, because this is really uncommon whenever it comes to health tech space. So thank you so much, and I'm grateful to the audience as well. Okay. So coming back to your question, I think expecting law to be flexible is unrealistic and less pragmatic, because legal framework is supposed to be comprehensive and rigid. What we need as an innovator to thrive is for the law to be interpreted in a certain manner. That is what is more important. So certainly India doesn't have HIPAA equivalent health data laws or EU AI Act equivalent risk classification regime. And that's what creates the gray zone, I believe, for most of the innovators. But I would gently push back on that gray zone as an excuse, and I would rather advise the innovators to adapt the compliance first approach instead of thinking that as an excuse. That is what is more important. Certainly, India doesn't have many statutes that govern AI innovation, because DPDP, as we know, that it is still pending complete enforcement. Then we have CDSCO, which has recently given guidelines for software as medical devices, because it still identifies SAMDs as drugs and not as SAMD specifically. So it's a guideline again. We have telemedicine guidelines. So again, these are just the guidelines. So I believe most of our statutes were not written keeping AI in mind, but that should not stop us from innovation. So what we need to understand is, we still have global data protection statutes, global AI regulation statutes, and we can always seek inspiration from them. We can refer to them. For example, HIPAA has a BA, Business Associate Agreement, right? So I often tell founders and innovators that why can't we work on the similar framework? Because it serves the same purpose. That is Business Associate Agreement. So basically, the whole purpose is to ensure that all parties to that agreement are, understanding and are abiding by the data protection regulation that HIPAA gives. So that is what is important. So I think if we understand that even if we don't have laws, but our practice is very much similar, to the innovations that are happening across the world, and they have their statutes. So why not just take reference, inspiration from those statutes, and that would help us in a greater way.
That's a great legal perspective to think. Now, Dr. Ajit, I would like you to build in that, because as you're someone who is building AI for healthcare, it's like regulations, founders feel regulations limit innovation, whereas regulators argue it protects the patient. So, what do you think the right balance is? Where does it lie? And how can we innovate rapidly without compromising patient safety and trust?
Right. So first of all, it's a pleasure to be on this panel, and I thank the organizers for it. As a founder and a practicing general surgeon, what I feel is innovation and regulation are not opposing forces. Proper regulation is going to support innovation, and it'll make it safe for the patients and also the system. So both of them go hand in hand. So it's like if an AI recommends a restaurant for an evening dinner and it makes an error, that is just an inconvenience. But if an AI is involved in influencing a clinical decision, that can be life-changing. So innovation and regulation go hand in hand, and regulation should depend on the risk of the product involved and not just blindly because of the labels. So as founders, we should not ask a question like, should we go around the regulation? We should create enough evidence that supports safe and proper healthcare products to, especially with patient safety. That is the prime focus of my products as well.
Next, I would like to panel the panel to focus on trust. And with that, Sneha, everyone talks about patient consent, but very few patients actually understand how the health data is being used, collected. So in the age of AI, what does meaningful consent really look like?
Okay, first of all, I feel I would be the wrong person to talk about consent, since we have had such a wonderful presentation by Certinol on consent. And it's really commendable the kind of work they are doing, because, so I also conduct medical legal trainings for doctors and hospitals. And trust me, it is so difficult to convince them, because whenever we represent a medical negligence case in the court, the two significant parameters to it are, how the case is actually decided is based on these two documents. One is consent and the other one is clinical documentation. So it's very difficult to make them understand that, consent is not just a formality. It is also your legal safeguard. It also saves you from the potential lawsuits. So yes, if I have to talk about meaningful consent, I would say there are certain parameters to it. For example, does the consent have a purpose that is easily understand? A patient can easily understand that. Secondly, I believe, you can corroborate, Kanjan, the consent, whether it is granular, and the approach is rather not like assume and accept everything that is given in the consent. And granular consent is basically, it gives the patient an opportunity to give consent at certain intervals, especially when the purpose changes, right? When for which the data is procured. And the third one I would say is very important is the consent revisable. Can it be revised? Because if the purpose changes, then what? It needs to be revised. So these three things are very crucial, I feel, if we are talking about meaningful consent. So DPDP Act, as we know, it emphasizes a lot on consent part. So all it says is the consent has to be free, specific, it has to be informed and unconditional. So it sounds very easy until it applies to AI system.
Yeah, let me add to that. So meaningful consent, on the other hand, apart from what DPDP law says, right, it also needs to be put into a lot of context when it comes to healthcare. For example, minor consent. DPDP law says that you need to establish a link between the minor and the guardian that comes to you. But are you going to be able to do that when a child comes to the hospital with a guardian just for a consultation? That is context number one. Context number two is that the same child and the parent are going for a surgery. You will establish the link in the second one, but the first one you may want to just take the name and the mobile number and the relationship between the two, because you are not taking any risky bet here. So when it comes to healthcare, the law needs to be interpreted in the context of what kind of risk it is there. If you take the consent, if you don't take the consent, where it applies, in what measures you should go up to. You can't take an Aadhaar card when all the parent is asking is that the child has a fever, right? So that is a meaningful consent in my opinion.
I would like you to build on that, Kanjan. When it comes to patients, what they understand is the privacy conversations start and end at consent. But as we know, patient data has a longer life cycle. Now that how it is being collected, stored, and now it's even being fed to AI, for further things. And as Sudhir from Sentinel explained a lot about consent, I would like you to say that what is the provider's responsibility when it comes to it, and what does provider own to the patient? And to add on, I would like you to also talk a little bit about living consent and what that means and how can providers go about it.
Sure. So taking that first yes from the patient is just the start of the job. It doesn't end there. For example, an unconscious patient comes in, the hospital treats it and nobody asks for consent. Absolutely correct. Law agrees that law has a 7D clause around it. Everything is perfect, right? And then the patient is conscious now. Nobody asks for anything else. The care continues for 2 more days. Is it correct? The answer is no. The journey changed after the patient became conscious, and now if you are collecting further more data points after they have been shifted out of the emergency care to any other ward, you need to be now taking the consent. Now most of the solutions right now in the market, or even hospitals are not even thinking of this journey, that you have to, even if you are not taking the consent, you have to register it as a 7D in your systems, that okay, I'm not taking the consent because it is an emergency ward. Second, and very much all of us would have received WhatsApp reports from laboratory, where the report is either just sent as a file to you or as a link to you, right? And you can simply open it, and anybody can open that link. Have you ever seen that? If you it never asks for any authentication, right? 1 month back, I had my some reports done, and the lab sent me a link which had digital numbers at the end. And by mistake, I changed last digit, and I was looking at somebody else's report. So the responsibility doesn't end at a hospital gate. It follows the file wherever the file is following. So that is the responsibility of the providers, and that is where I would like to.
Staying with you, what is the biggest misconception healthcare startups have when it comes to handling patient data responsibly? And as AI is becoming part of it, what governance practices should be non-negotiable to maintain and build that?
So I'll answer the second one first, governance bit. Like she mentioned that the consent needs to be granular enough, and that is all the law, DPDP law is all about. That if you have not taken the consent, please don't use it. At some point, it is going to bite back. So be very, very careful about, and specifically AI, because if you are using AI laboratories which are not in India, or let's say you do not have a contract with them to not train their own systems on it, or if you are passing the PII data into AI, that is going to be a nightmare, because it is going to remember it. It is going to spit out at some point to somebody else, and you are going to be paying for it. And if nothing else, if it doesn't go wrong, then also it is going to be a very big challenge when the regulator asks that, hey, are you training the AI models on top of this, yes or no? And if you don't have a BA agreement with the vendor that, hey, you are not training the data on top of my data and all of that, then it's going to be a nightmare. So that is the governance bit. Coming back to the biggest misconceptions, there are a couple that I see a lot in the market today. One, that DPDP law is the only playbook. That's incorrect. We already had laws, sectoral laws like mental health law, termination of pregnancy law, and HIV laws, right? All of these laws are already stricter than DPDP. Now, what DPDP says is that, here is my framework, and if any sectoral law is stricter than this, that wins. So now, as a hospital, you need to be able to demonstrate that, okay, I am not going to, a patient comes and says, delete my data. You can't delete the data for a patient on whom you had done a surgery, and because it is required by the clinical law, medical laws, to retain it for 7-10 years. So you should be able to delete the data which is not required by the clinical law. At the same time, you should be retaining the data which is required by the clinical law. So this is, all of this is, so DPDP is just, starting the discussion. Discussion will end on all of these complexities within the healthcare, where multiple things needs to be taken care of, and one single frame of the governance needs to be created for from the healthcare perspective.
So that's about regulation, consent, governance. But all of this makes no sense unless AI is making into the clinical work, the implementation part. And for that, I would like to come to you, Dr. Ajit. Interestingly, many AI solutions fail not because technology is weak, but because implementation becomes complicated. And from a regulatory, clinical, governance perspective, where do startups most commonly get stuck when it comes to moving from pilot to deployment, and what can they do differently?
Right. So most commonly, it is always the AI solution being built first, and then they look for the pain points to implement that. So that is a completely opposite direction to go through. So the first thing should be to talk to the clinicians, figure out the clinical pain point that can be addressed through AI, talk to the nurses, hospital administrations, even patients as well, because they are aware of the bottlenecks that are there in that specific institution. So that is the first step. Once you identify the pain point, you need to build the AI system around the clinical workflows of that institution. So it makes it easy for the doctor to adapt it. Otherwise, all the doctors are already burdened by so much workload. They hardly get time to sit sometimes in surgical specialties. So if you're asking them to make another click, open another box, add a picture into this, it is highly unlikely that they'll adapt your solution into their systems. So the focus must be on making the AI model work through the systems that are already existing, so that it'll be easier for the doctors to accommodate it. Thirdly, when it comes to governance, the model that has been built now should be validated in the existing systems. You cannot validate it on a general basis and expect it to work in every institution, because each hospital has its own structure. It must be validated within the environment where it is being used. So validation aspect is also very important. In the same way, they must be very open about where they're collecting the data from, where is it being stored, how are they going to use the data, and is the patient aware of this? So if they get these three things right, I think it'll be easier for them to adopt AI solutions within any existing workflows.
I would like to add on the part of how can the patients be aware of the thing. It's really not spoken to the patients. It's between the vendors, between the providers always. So how do you look into that?
Yes, that is a big loophole, because we just heard about how consent should be taken, and the patient must definitely be always aware of where his data is going. Are they using it for the AI model? Are they using it to make the model better? Where is it being stored? Is it going to be deleted anytime soon? Or what kind of data is being put out there? So if the patient is not aware, there won't be trust, and AI adoption will be difficult. So that must happen. I mean, maybe when the patient is getting admitted or going for surgery, they must be informed it properly in an understandable language.
I'll add to that, and that is where the DPDP law is actually helping. It's just that interpretation is not very clear. It clearly says it has to be purpose driven. Maybe the patient doesn't need to know that where exactly the data is being stored, or how many vendors you have. yes, it needs to be given in a notice, and that's why it is one of the significant part of it. But the patient at least needs to know that what is the purpose for which you are going to use my data, and I should have the control over it. So as for a hospital, treatment consent is fine. It is given. But after that, are you going to use it for marketing? Are you going to use it for AI and all of that? Those are granular consent, how she talked about, right? So the entire idea of DPDP is built around this. I'm sure, as the ecosystem progresses, awareness builds in, everybody will be able to understand, okay, this is how I would need to take the consent, and this is exactly where, things, settle in the framework.
Great. I would now move the conversation towards accountability. So, if an AI recommendation contributes to patient harm, accountability isn't always straightforward. Until dedicated regulations emerge for AI, Sneha, how should startups, hospitals, clinicians think about product liability, contracts, and shared responsibility? We had Dr. Uma earlier talk about shared liability. So I would like to know the legal perspective of how this can be looked upon.
So as a legal practitioner, like I talk to so many startups and innovators. So whenever they are giving me the demo, because I need to understand, right, to understand the loopholes of their innovation in terms of compliance and legal aspect. So whenever I try to understand their innovation, there are three things that I bear in mind. One is whether there is accountability by default. Now, this is not, something related to the platform, but this is attributed more to the founders or innovators. Second is whether they have outlined the liability in their entire business structure, because that comes to the product liability aspect of it. And the third one, which is again another important thing, but most of the time it is just on the papers and it is not implemented by platforms, that is breach response mechanism. So I believe these three things are extremely crucial if I have to look at it from the lens of law. So like I said, accountability by default is like how we have privacy by design for these platforms, right? The principle is pretty much similar. So accountability is not an afterthought. It has to start with the inception itself. Similarly, compliance has to start with inception itself. Compliance cannot be thought about for the later stages. For the later stages, you have legal, you have law, you have statute to take care of it. But what you need to start off with your innovation is compliance. Similarly, product liability, like you said, yes, what Dr. Uma ma'am stated correctly. Product liability is something, if we are strictly talking about AI innovation, there is no liability regime that exists in India. These laws are very specific in Singapore, in the US region, but it is not there in India. So that is something that I can talk about, in length, because that topic is very close to my heart. And I'm also studying on it as a legal practitioner. So basically what we need to understand is, if that innovation, if your algorithm fails to detect something and the patient is harmed as a result of that, who does the liability lies on? Because the general principle of liability is who is the easy target. Whoever is easily accessible is the easy target and easy to put the liability on. For example, in the court of law, the patient is going to sue the doctor, because certainly he is not aware about what the innovation is and who the founder is and what they have actually done and who's actually at fault. So I think this is something that needs to be scrutinized. And same with, I think, breach response mechanism. So I think collectively all of these things contribute to developing a responsible AI, which is in the end is the main, intention.
I would like you to build in that and talk about from your experience that what legal decisions made in the company's early days become costly mistakes later.
So I'll give you a very simple answer to that. Like I said, and even Dr. Ajit mentioned that, I'll just reiterate what he said. We need to understand there is a thin line between legal and compliance. We often talk about legal and compliance together, but that's not how it operates, okay? Legal is very regulation oriented, whereas compliance is very practice oriented. Compliance starts at the time of inception. So there is something, I always call it as accountability before commercialization. That needs to be understood. So compliance also. So it goes that way. I mean, for example, even Dr. Bhaskar mentioned that we celebrate too early. We get briefed in so many cases, and when we see their briefs, we are deeply pained to see that there were so many instances where the things could actually have been taken care of, but they were not, because again, the innovators were probably too complacent to think about the compliance aspect of it. So I think that is the only mistake. We need to understand that compliance starts with inception, and it's an ongoing cycle. It never stops. As long as the data lies on your platform, compliance is an integral part, and it is going to be a vicious circle that you have to be aware of all the time.
Thank you for that, such great insights. Now I'd like to open the panel for a question. That's healthcare has always been built on trust between patient and clinician. So as AI is becoming another participant here, what new responsibilities do healthcare providers and technology companies own that didn't exist 5 years ago? I would like to start with Kanjan and end with Sneha here.
Okay. Am I audible? Yeah. So in past we had simple mechanism that it used to be based on the trust that the patient would trust their doctor, and it was fine. Then came the digital world where the data started accumulating, and now with that risk also started increasing. Now we have one more party in the room, which is AI, right? But if you look at the overall journey, right, the overall it needs to just it stands only on certain tenets of the data, that who has my data, who can access it, for what purpose are you using it, and can you delete it if I ask you to delete it. That is all you need to answer if you were to take care of your data, irrespective of how many more parties come into the picture. If you answer all these 4 questions, you will be fine. That is the way you should drive your how you are framing your entire system around healthcare data.
Dr. Ajit?
So from a founder's perspective, I think we have levels of trust to establish with the organizations, with the doctors, and with the patients. So with the hospitals, they would obviously like to know where the data is coming from. Has the bias been addressed within the data that we collected? Because Indian data is very rare, and we do not have enough data to create a model for Indian population. That's what we figured with psoriasis and arthritis, and we have so many cases and so much data, but it is not publicly available, so the data is often taken from somewhere else. So there is obvious bias in that. So we need to address that and how the data is being validated as well. And then the validation must again happen in the clinical settings that it is being implemented, otherwise it is going to fail. So next, with the doctors are always open to change if there is enough evidence. Any new treatment regimen that has a good publication, they're open to use it. In the same way, even with AI, if there is enough evidence that AI is safe, the predictions are safe, and there is always human oversight in the AI, doctors will obviously be open to it. And when it comes to the patient would want to see the doctor's face when he comes to the clinic. If a machine is talking to him, they would not trust it at all. So any clinical decision made by AI should have a doctor supporting it, validating it before it goes out to the patient. So this is how we can establish trust, and also to be very transparent about the limitations of the application as well. It's all positive till something negative happens. So they must be transparent about what the application can do and what it cannot do, so that it can be organized properly and trust can be built up. As she said, trust is to be built up right from the beginning, not after the application has been developed. Include the clinicians within the process right from the beginning. Take their feedback so that you know what their workflow is, so that you can develop an AI model around it, and that would work well.
Sneha?
Yeah, I think we can agree on the same point that trust is directly proportional to accountability, right? And how do we ensure that? So I think for every innovator, I would say, as a legal practitioner, what is important is to have your policy framework in place, to have your consent framework in place, to have a robust contract which outlines and defines the roles of all the parties that are acting as players in your business. That is extremely important, because until and unless that is in place, you will not be able to decide the liability. You will not be able to limit the liability for yourself, and you will not be able to decide the indemnification for all the parties, because this is the only thing as of now that can vouch for your accountability and your credibility. So I think these things are extremely important and needs to be taken care of. So I can only say that focus, all innovators, the focus should not be only on developing an accurate AI, but it should be more on how robust your accountability architecture is. That is more important.
Thank you. Thank you so much. We thank everybody on the panel for the exceptional insights.
Thank you. Thank you.
All right, thank you. Thank you so much once again for all of you for that engaging discussion. And now I request Jhanvi to kindly hand over the token of gratitude for all our esteemed panelists. All right. Okay, I request Venkatesh also to kindly join us on stage to do the honor. All right. Well, ladies and gentlemen, once again, let's give a huge round of applause. Thank you. Thank you so much for all of you. So I think you can also join for the picture, one group photo together, and then we can proceed with the next segment. Well, so once again, thank you so much for that wonderful, engaging discussion on the topic. Thank you, one and all.